welcome back to the morning show here on Rise News. Very exciting morning. And changing the conversation now, still talking about coronavirus, but the health aspect. The fight against coronavirus is stepping up globally. Every measure has been put in place to stop the spread of the virus.
Indeed, with the involvement of more doctors and health workers as volunteers, Nigeria is not leaving any stone unturned in ensuring that the virus stops spreading.
One of the measures is reducing the number of exponentially growing infections by ensuring a community isolation that keeps the daily number of disease cases at a manageable level for medical providers.
So joining us now to discuss flattening the curve, which is the norm everywhere in the world of coronavirus, is Dr. Ola Brown, the founder of Flying Doctors Healthcare Investment Group. And, you know, Dr. Ola Brown, you're quite very germane to this conversation because you run an air ambulance service. You run the logistics of disease. So let us understand, you know, your clear input. In fact, Atero Peters, I was speaking yesterday, was saying you need a retinue of people to fight coronavirus. You need logistics, people in logistics. So you combine logistics and being a medical doctor. You also studied in Japan, where the East, where they have a lot of all these diseases here and there, SARS, MERS, and the like. So you've got more than enough experience. Dr. Ola Brown, go ahead.
So your question?
Yeah, so my question is, let us understand how we can use logistics to fight this, transporting people, helping people, setting up centers.
Okay, so I'll start with a bit of background on sort of the global picture of coronavirus. So the coronaviruses are a group of viruses that tend to cause severe or mild to severe respiratory illnesses in people. And that's the kind of problem that has been faced in Europe, that's the kind of problem that has been faced in America, and that's the kind of problem emerging in Africa. Now, what should we be doing about it? And I'll tell you why I think our management strategy in Africa, including Nigeria, should be a lot more aggressive than what happened in Europe. So if I was to give some figures about why I feel that we should be a lot more aggressive, I'll start with one of the more serious effects of coronavirus. As you know from watching the news from New York and Italy, one of the biggest issues and why healthcare systems across the world have virtually collapsed, a lot of them are under great strain, is because there's a percentage of patients with coronavirus that develop respiratory failure and need to be put on a ventilator. Ventilation is quite complex and it involves a lot of things. You need intensive care physicians, you need the right equipment, so not just the ventilators, but you need to be able to measure the amount of oxygen in the blood with an arterial blood gas machine. You need to be able to keep up the circulation using special drugs. You need a whole load of equipment just to maintain one intensive care patient. And it's intensive care patients that are putting such a massive strain on the healthcare systems in Italy, and we see in New York and California similar things where they just can't find enough ventilators and enough intensive care physicians to look after these patients. And that's why you're seeing these absolutely, you know, horrendous figures. I mean, 1,000 people dying in a day. For comparison, in the whole of the US in a year, and maybe about 5,000, I'm not sure of the figure, but about 5,000 people die from flu every year. But you're seeing that in a single day in Europe, where almost 1,000 people die because of these really severe respiratory effects. And America actually does quite well in intensive care. So if you look at the statistics from America, you can see that there are 35 intensive care beds. Those are the beds with the ventilators and the ABG machines and the inotrope machines, so the machines that keep the circulation going, and all the other things required to look after an intensive care patient. There's about 35 for every 100,000 people. Italy, as well, for intensive care, there's about 12 beds for every 100,000 people. So you can see those numbers are quite encouraging. In Nigeria, there's 0.07 beds for every 100,000 people. And we're not just talking about the beds, we're also talking about the intensive care physicians that have to look after these patients, because there's no point buying the equipment if you don't have intensive care physicians to train to look after these patients. So I've been, on the air ambulance, most of our patients are intensive care patients. I've been in the business for 10 years, as well as expanding into other areas of the healthcare business as well. And even after 6, 7 years as a doctor, I'm not an intensive care physician. I know how to use a ventilator, but I don't know how to use it well enough to be an intensive care physician. It takes about 8, 9, 10 years of solid intensive care or anesthetics to be able to do that. And the numbers in Nigeria are abysmal. So we keep on hearing people, we're buying more ventilators, we're getting more ventilators in, we're importing from China. But that's not the issue, right? It takes a long time to know how to learn how to use a ventilator and look after a patient in intensive care. In fact, most people do a regular specialty like anesthesia or respiratory medicine or acute medicine, and then on top of that, layer on intensive care training after their regular specialties. So we don't really have the manpower, and that's why I think that in Nigeria, we really have to be super aggressive in terms of taking preventative measures. And I'll talk more about the things that we should be doing in Nigeria as the interview goes on.
And to be specific, the Minister of Health did say that there's so much fixation on ventilators, and that should not be. The country is importing about 20 very soon. And he says that the cases we're seeing in the country are mild and not severe, so they might not be needing those ventilators. But let me ask you, because indeed this pandemic has revealed vulnerabilities in healthcare systems globally. I mean, who would have imagined that Cuban doctors would be receiving heroic welcome in Italy, or that Taiwan will be sending masks to the US and the EU, and then that China, like many other countries, are building temporary hospitals to take care of COVID-19 patients, including Nigeria. So, Dr. Ola Brown, you've talked about the way we're fighting this. What has been most outstanding for you, if anything? And then in Nigeria's context, what should we change? What are those specifics we should change, apart from these ventilators, which you've highlighted?
Okay, I'll start with your last question and then move on to sort of the high points for me. So in terms of Nigeria right now, what are the things that we should be doing? I think it's the boring stuff. I think it's stuff that people don't really find attractive. And I think that doctors haven't really been the most vocal, the voices that you've been hearing on coronavirus. So doctors tend to be quite humble and quite quiet and just, put on their PPE and do the hard work. But then we're not hearing doctors' voices. So the people that are buying ventilators are not the doctors. We know that ventilation and buying all these masses of ventilators isn't going to solve the problem for Nigeria because we don't have the people to operate them. So if you like, buy 10,000 ventilators, buy 20,000 ventilators. It's not a ventilator issue because we don't really have the manpower to manage all these intensive care patients. And when you have an intensive care bed, it's not just about the ventilator. There are a lot of other machines that you need to maintain a patient on intensive care, except the ventilator. So I think ventilators have been the buzzword in Nigeria, but actually, I think the more boring work is more important. So things like raising awareness, basic public health is really important, making sure that people know the importance of social distancing. And even though we talk about it a lot, as a middle class in Nigeria, a lot of people at the grassroots haven't gotten the importance or haven't fully understood the importance of social distancing, haven't understood the importance of hand washing, haven't understood the importance of respiratory hygiene. And these are messages that we really need to promote in every single language all over the country again and again, so people can really come to terms with what a disaster it could be if we don't take these measures. These measures are very painful, they're very inconvenient, and they will drag. Nigeria has the largest number of people living in poverty in the whole world right now. But these measures that don't allow people to go out, people that earn daily money to go out, that decrease the earning capacity of the most vulnerable people, are extremely painful measures. And we have to explain to them why we're having to take these measures and what the situation could be, which is a complete disaster if we don't take these measures. And when I say the word disaster, I'm talking about the country with one of the highest numbers of ventilators, highest numbers of intensive care physicians in the world is suffering. And they're projecting that they're going to lose about 200,000 people. And this is America. If you look at Italy, Italy is losing 1,000 people per day, 1,000 deaths per day. And if you look at the number of surgical specialists in Italy, they have 115. for every 10,000 people. Nigeria has 1. So our healthcare infrastructure cannot take the burden of severely sick people. We cannot take the burden of having people on ventilators. We cannot take the burden of even having very sick people that are not on ventilators, so more of a high dependency unit patient as opposed to an intensive care patient. So Africa's strategy has to be awareness, social distancing, hand washing, and then surveillance as well. And I think that we underestimate the importance of surveillance because you can't buy it, right? So there's no way that the boring kind of work of contact tracing and, you know, follow up and making sure that, you know, people get tested, it's not something that you can just put in a container, right? You can't put contact tracing in a container and import it from China. And everybody is looking for solutions that you can import or buy or just put 10 billion and everything will happen. But unfortunately, the real work of epidemiology, the real work of public health is the boring stuff. It's hand washing, it's respiratory hygiene, it's surveillance, it's contact testing, contact tracing, and it's aggressive testing. And these are things that we can develop the infrastructure for in a small amount of time, as opposed to trying to develop the intensive care infrastructure, which is harder to develop. And if you look at the countries that have been very successful in managing this virus, even the richer countries like South Korea, like Iceland, that have been quite successful.
We will continue this conversation after this break. Please stay with us. Show. We are still joined by Dr. Ola Brown here with us from the Flying Doctors Healthcare Investment Group. Now, my first question to you is I would like to know your level of involvement with the NCDC as well as the federal government to help curb this disease. Now, one, and secondly, you had mentioned, taking the burden off, the medical doctors who are doing some of this work. Yesterday, the early hours of this morning, there was a report by the Nigerian Association of Resident Doctors that they had confirmed the death of one of its members to Lassa fever. So while the entire nation is looking towards COVID-19 and coronavirus, we need to also understand that there are other things that are killing our doctors and our citizens. Is the Flying Doctors Group doing anything to maybe work on those things to alleviate the stress on our medical doctors?
Absolutely. So, like I said before, the best sort of measures that we can do in terms of support are around, it's really, really boring. And I keep repeating myself because people don't want to accept that these are the best measures that we can take. They want us to buy ventilators and they want us to invest in intensive care equipment. But the most basic things that we can do are make sure that as doctors, that our voices are being heard. There's a lot of voices going on right now. There's people from the entertainment sector speaking. There's people from the corporate sector speaking. But we're not hearing enough doctors actually with a platform speaking about this. And I think that this is a time that we really need to listen to the experts. So I think that epidemiologists, we should get more epidemiologists speaking about it and raising awareness in their communities. And we've done a very, very big awareness campaign to make sure that we're trying to reach people at the point of their understanding and trying to raise public awareness about these issues. Another thing that we've been doing is supplying PPE, because one of the trends that we see in Italy and we're beginning to see in America is that the people at the highest risk of catching COVID are the healthcare workers, the doctors and nurses that spend the most time with the patients. And they're spending time with the patients in an enclosed environment. So in an open environment, it's actually much harder to catch the disease. But in a closed environment where there's a high viral load, you see that doctors and nurses are exposed more frequently. And also a special risk is in these intensive care units where patients are on ventilators. When in the process of putting an airway into a patient to help the person breathe, the virus can become an aerosol. So it can become a little, I don't want to use the word airborne because the WHO says it's not airborne, but it can come into smaller particles that make it easier to catch. So because of that, protecting our healthcare workers is key, and making sure that they have the right personal protective equipment whenever they're going in and treating these patients has been a key area for us. I've spoken a lot about the work, the real work, what I call the real work of epidemiology, the detective work, contact tracing, and also testing. When you look at countries like South Korea, like Iceland, like Japan, that have done very well in terms of their mortality and their number of cases, you can see that they emphasized on the basics. They were doing very, very aggressive contact tracing and surveillance. They had widespread awareness about social distancing, respiratory hygiene, and hand washing. And also, they tested. Because in Iceland, half of the people that they tested were asymptomatic carriers of COVID. So they didn't have any symptoms, but they had the virus. And some of the biggest spreaders around the world have actually been asymptomatic carriers. So we need to make sure that we're focusing on the fundamentals. So we're also in collaboration with Lagos State doing an isolation center. We've also started trying to started a challenge online. I've given away one of our older, more simple ventilators to see if we can fabricate one in Nigeria. But these are about 10% of my focus on ventilators and isolation centers. 90% of the work that our group is doing, and of course, most doctors and healthcare experts are doing, are around the basics, the things that are not attractive, the things that you can't import, the things that you can't throw money at, which are the work of awareness, making sure that we get to the communities and we communicate to the communities and meet them where they are. Number two, isolating people and making sure that people that have tested positive are isolated, making sure that their contacts are traced, and making sure that we follow up on those contacts that are traced. That's the work of surveillance. And number three, testing, making sure that we ramp up testing so we know the scale of the problem.
Okay, I want to talk about testing. WHO head did talk about testing. You made mention of countries that are doing well. Germany is doing well because Germany is averaging 500,000 tests per week. The UK is not doing well because the UK is averaging about 15,000 tests per week. In Nigeria, there's still a lot of selective testing. At first, it's when you show symptoms or you have contact with the people, and secondly, maybe your social status, that's part of it. How can we make testing be as basic as anything in this country?
Germany is doing well. I would say Germany is doing fantastically. They have the lowest mortality, one of the lowest mortalities in the whole world for coronavirus, to the extent that they are sending planes to Italy to go and bring the patients. Like, okay, you people are having problems, we'll look after them. Because they have one of the highest levels of intensive care beds to the number of patients. They have a high doctor-patient ratio. And they've also really dedicated themselves, like South Korea, like Iceland, to testing. And this is something that I know that the Nigerian CDC is working on and Lagos State is working on, which is improving and accrediting more laboratories, PCR laboratories, really training people, because PCR is a complex technique. When I was in Japan, it was 50% fellowship, so I was 50% clinical and 50% doing bench and lab research. So I realized that PCR technique and people that are trained in the PCR technique, which we use to diagnose COVID, it takes a long time to gather those skills, and it's quite an intensive and unfamiliar methodology. So we need to train more people to be able to learn the technique. We need to open and accredit more labs, and we need to ramp up testing. And I believe that the Nigerian CDC and the government are doing as much as possible within our constraints to make sure that we can have the capacity to test more people, because that's really, really key. Like I said, and I'm going to keep on repeating, awareness, surveillance, contact tracing, testing. Once it gets to the hospital, once we start getting to the issue of ventilator or no ventilator, I feel that we would have lost the battle in Nigeria, would have lost the battle in Africa, because we don't have the capacity. And we're also bidding on those ventilators and trying to compete with Americans that are just going to China and buying the whole factory. We're trying to compete with Americans that are sending Air Force jets to China to go and pick up planefuls of ventilators, and they're paying double the price that we would be able to afford to pay. When we're competing with somebody that money is not a problem, then we need to actually have a different approach. And our approach should be more preventative. It should be more focused on the basics so that we can get on top of this without having to get to the intensive care stage that we see in Italy, in the UK, and in the US.
So tailoring our response locally. I'll need your response in about 60 seconds if you can. Flattening the curve has almost become like a mantra, but shouldn't we see the peak first before we see that curve flatten? And do you think that we have seen the peak in Nigeria in 60 seconds?
So I don't know yet if we've seen the peak, but we know that the number of cases are rising every day. And what we're trying to do is get to a point where we see the number of cases become flat or even decrease. And for the last time, I'll be repeating that the way that it's not a fight for healthcare workers, it's not a fight for bankers, it's not a fight for politicians, it's a fight for everybody watching right now. Social distancing, please stay away from each other if you can. If everybody in Nigeria could just stay away from the next person for 2 weeks, this crisis would end. So please, social distancing is very important. Washing our hands and personal hygiene is very important. And respiratory hygiene. Don't cough on anybody's face. If you need to cough, cough into a handkerchief or cough into your elbow. Thank you very much for your time, and I hope this has been helpful.
Very helpful indeed. Thank you so much, Dr. Ola Brown, for coming on the show today. Fascinating insight.